it. Awesome. Well, I think it looks like I'm not seeing the participant list go up super fast, so I think we'll go ahead and dive in. I'm going to introduce myself and my colleague who will be kind of co-hosting our session this afternoon, and we're going to tell you a little bit about AMAZE and then really spend most of the time with our two featured speakers today. So really excited that you're with us. So a little bit about housekeeping. I know we all live on Zoom these days, but just a couple of reminders. We are recording the session. We know a lot of busy educators are not able to make this live today, and we will be sharing the link to the recording in the follow-up email that will go out after the webinar. So never fear, if your colleagues couldn't be here today or if you need to head out early, we will be recording today and sharing that link with you. Also, just a reminder that what we're going to do is we're going to hear from both educators back to back and save all of your questions for the very end. We've got time afforded to do that, so I promise we won't run out of time, but just know that we are going to make sure we get both presentations in first and then pivot to the Q&A at the end. So who the heck are we? So by way of introduction, my name is Nora Gelprin. I use she, her pronouns. I am the very proud Director of Sex Ed and Training at Advocates for Youth. I'll invite my colleague to introduce himself.
Good afternoon, everyone. My name is Dan Rice. I am the Executive Director at Answer. We are one of the other partnering organizations on AMAZE, and I'm thrilled to be here with you all today.
Great. So I'm going to do the beginning. Dan is going to wrap us up at the end with the Q&A. So you will hear from both of us kind of bookending today's presentation. But let's dive in a little bit more and give you some reminders about what the heck AMAZE is. We really are an educational resource here to help. We are, as Dan said before, we work together between 3 different organizations. So Answer, Advocates for Youth, and Youth Tech Health. We all work together. It really does take a village these days. Wanted to just let you know that our goal is really to take the awkward out of sex education. I just love our tagline. These are some of the more recent videos. So if you've not had a chance to check out amaze.org recently, we really recommend that you keep coming back and visiting us. We'll have opportunities for you to sign up for our newsletter, which shares some other educational resources toward the end. But we are pretty consistently putting out new content pretty much every other week. So there's a lot of great stuff on AMAZE. If you haven't had a chance to check it out recently, I invite you to head over there and see what's new. Also excited to share with you the map about how AMAZE has really been spreading internationally. I won't liken it to a pandemic because it's way better than that, but look at that spread across all countries around the world. Whether that's subtitling videos, whether that's making cultural adaptations of videos, whether that's really thinking of new content in videos that better meets the needs of learners around the world. It's really exciting to see the appeal and the interest in using AMAZE resources all around the world. Really exciting, amazing work. So let me just pivot and introduce our first educator, and then I'll tell you about our second, and I'm going to turn it right over to them. We're really excited to have Ellen Friedrichs from a Brooklyn-based school in New York City. She's going to be our first presenter, and we were just so wowed by her application when she submitted it to be considered to be a speaker. She's going to be talking about sexual health care in a video that really focuses on that topic first. So get ready for that. It's going to be super fun. And then second, we're going to have Friedrichs, and she's from Calvert Public Schools in Calvert County, Maryland. Also going to be looking at a video around sexually transmitted infections and the prevention of those. So I think that these two really paired nicely. We were really blown away by their applications and just delighted that these busy educators would find some time to work with us at the very beginning of school years to be able to present this today. So I will stop sharing my screen and invite Ellen to share her presentation and turn it over to her once she gets settled and situated.
Hi, everybody. So I'm going to start by sharing my screen. So give me 1 second. Okay. So thank you so much for being here. I am really, really thrilled to be able to do this with AMAZE. Just to tell you a couple more things about me. Oh, I'm going too far ahead. I don't know why that just happened. So I'm the coordinator of health education at a school in Brooklyn, and I've also been teaching at college level since about 2006 as well, where I focus on health education and human sexuality. I'm the author of a book called Good Sexual Citizenship, which is really designed to help people figure out how to dismantle sexually hostile climates. And I have 3 kids. They are really the ages right now of a lot of the children that I work with. So that's an interesting balance to be a parent and then also to teach middle school and high school. Today, I'm going to focus on my work with middle school and high school, but specifically with the high school lesson plan that I created, which was really enhanced by the AMAZE video. I was so delighted when that came out, I think only a year ago or so, maybe not even. And just to think about in the context of my lesson plan, where this is coming from. So I am really fortunate enough to work at a school that really supports comprehensive health education. And we teach starting in 5th grade, so middle school, all the way through 12th. We have a combination of monthly workshops, weekly classes either meet once a week for a year, in high school for a semester. And we work really closely in tandem with a lot of other aspects of our school community. So it's currently we have 2 full-time health educators and then a part-time health educator who's part-time with us and then part-time doing equity work, which is actually really, really helpful to have somebody who's so invested in one of the goals that we have in health education, look over our work, give us input, and really help us strive for that anti-racist, inclusive lens that we really hope to provide for our students. One of the things I'm really excited that we do is our mentoring program. So we have 11th and 12th graders who apply to be high school mentors. And then once a month, they will come into an 8th grade health class and they'll basically take over. They don't teach traditionally, but they come in, they pick a theme, they work with our kids. They also run groups where the kids can talk to them about issues like having blended families or divorce. This year, they're starting a community service project with the middle schoolers. So there's lots of ways that we like to get involved beyond the classroom. So our school is predominantly, it's a private school, and about 65% of the students are white and about 35% of the students identify as students of color, people of color. And we have, as many of you probably have had, more and more kids are coming out as LGBTQIA. So we're hoping to support all our students in their identities. And that is something that we are striving for. So a lot of this is things we are working towards. One of the things that I actually find challenging as a teacher is that we have students who start with us, who will be with us in middle school, and then continue through high school. We also have a lot of new students come in high school. So how do we create high school lesson plans that meet the needs of the students who have had health since 5th grade, as well as the students who are joining us in 9th grade? I don't want to bore the kids who've already been there. I also don't want to assume knowledge of kids who might have had a very different health education or none at all. So that's actually why I think that the lesson I'm talking about today on accessing sexual health care is a good one to start with in high school, because it actually works to the kids who don't have as much of a background in health with us. It speaks to them, as well as kids who have had more in-depth help. So there's a lot of reasons that I really love this topic. And one of them is a big contrast from my own life. So I think I mentioned, or maybe I didn't, but I grew up in Canada and I now live in New York. And when I was a teenager, we had a very different experience accessing healthcare than what I see with my students and my own children today. I lived in a country with universal healthcare. And every year, a nurse from the local free teen clinic would come into my school and would tell us about the services. This was a place that provided abortions, contraception, STI and HIV testing in a time when an HIV test was a blood test that took 2 weeks, right? So this is a different era on a number of levels. And it was a place you could get to on the bus or you could walk to, and it was very private and free, right? So this is very different. So I moved to America and it was a totally different thing. And even for kids with health insurance, even for kids who live in states that afford them confidentiality for sexual health care, there are a lot of barriers to accessing services that I have had to learn about as an adult who wants to support children. So that's a big reason that that's a topic that is dear to my heart. So how do we do this topic? Okay, so I'm going to give you my lesson outline. So the first thing I like to do, and I'm going to say, this is structured for a Zoom class. So I've taught this topic in person, moved it to Zoom, and then in theory, we'll be teaching in person again. But you can translate this for your own purposes. It's pretty interchangeable, Zoom or in person. I always, like many of you probably do, if you're in the classroom or any community group setting, set class norms. And these I'll just share quickly. We're not going to go through them all. This is not a definitive list. This is simply, a template that I have found helpful, that we change every semester, that I get student input from. You notice in the last one, I mentioned pronouns. These days with Zoom, as many of you probably do, I just have my pronouns in my Zoom name as, a sign of allyship. And also, it's a way for me to mention my identity and to place myself when I mention my pronouns. So I want to own the fact that I am a white, cisgender, Jewish, 40-year-old mom of more than 40-something-year-old mom of kids, so that they have this lens. They know where I'm coming from, and they know my pronouns, and they know it's safe to share things about their identities that they may want to share. But I don't want to ever put kids on the spot and ask them to share things that might still be private, that they might still be working through. But this is something I'll do either in the classroom, write my name on the board, share my pronouns, or put it in my Zoom name. And I just have found that a really good way to kind of create our sense of community and safety in a classroom. To begin this topic, I like to start with a pre-test. I don't do that for every lesson plan, but when I'm starting a new unit or starting a new theme, I feel like it's a good way to ground us. And for this, it's just a 1.5 basically question test. This is it. So how confident do you feel in your ability to access healthcare related to your sexual or reproductive health? Very straightforward. And then they can optionally answer why they answered that way. I then ask them to pick a unique symbol or word, like put in potato, so that I can match the pre-test to the post-test that they'll do later and still keep it anonymous. I know there are many more sophisticated ways to do pre and post-test, but my very basic one test needs this has worked for me. So after they do that, we come back together, and I'll ask them either in person or in the chat to drop just what health services they think it might be hard for a teenager to access. And I'm sure none of you will be surprised to know that sexual health care is a big one, particularly abortion, but so too is mental health care. That comes up a lot as well. What never comes up is things like, getting a strep throat test or dealing with a broken arm. So there's a real division. You can see kind of the stigmatized health issues that emerge, the challenging ones, the ones where there are more barriers, obviously for some children without health insurance, or for children who live in communities where they don't have access to a healthcare provider. Something like getting a strep test is not easy. But in my community, most of our kids do have health insurance, and we live walking distance from many places where you could actually get services. So one of the things that often comes up when we discuss this is why. Why did you pick those services? And a big theme is that they're not certain they'll be confidential. And that's important to them, or they're worried they're going to get in trouble. So from that kind of pivot, what I do is I have them think about the services that they believe teens should have some confidential care. And I do that based on a study that was published a few years ago, 2018, in the Journal of Adolescent Health. And this basically asked kids and their parents what services they believed should be given to teenagers, adolescents confidentially. So from those questions, I just made a Google form, and oops, let me go back. And I just have the kids again go into an anonymous private Google form where they just answer what they think on a scale of 1 to 5. Do you think these things should be offered to teenagers confidentially? And then there's a space at the end where they can answer, or add any information that they might want to share with me or not. So in real time, we can then, because it's a Google form, when everyone's turned it in, look at what they all said, and it's all private. You don't know who said what. So after I do that, I'll ask them, so do you think your grown-ups would answer similarly to you or differently? And often they say, no, very different. We don't see eye to eye on these things. They want to be up in my business all the time. I need privacy. And at that point, I like to show them just the chart I showed you a minute ago. And I ask them what stands out for them, if anything, and they all jump to abortion. Oh, look at that, abortion. Twice as many kids as parents think that this should be confidential. Parents don't respect our privacy, but I actually try to move them away from focusing on that and highlight something else, which is that parents and youth seem to be more aligned than we often think. That on many of these questions, they're actually closer than you might expect. And yes, abortion, as we all know, if we're following what's going on in Texas, if we're following what's going on in the world, we know there's a lot of intense feelings and different views on this topic. Some are generational, but they span a million different reasons for different perspectives. But based on this, I try to have a conversation with them about what areas they think they could talk to their parents about and where they might see commonality And if they really don't think that they have a common vision with the grownups that they live with, their parents or guardians, who could they turn to for support and help? And I also like to point out to them that this is not actually what's interesting. It's not that every single young person is saying that they need confidentiality, right? So a lot of kids do want to turn to adults for help and support. And we see that in the numbers, that about 60% would like to think that you should have confidentiality with your provider, but it means about 40 don't necessarily think that's the most important thing. And that's something I think we should really encourage our healthcare providers to respect. I know with my own children, they've had two different providers who did this. One provider at age 12 gave the kids an iPad, kicked parents out of the room, asked them to fill out a questionnaire alone. I thought that was wonderful. We had to change doctors because of insurance. We changed doctors because of insurance. And the new place, basically you walk in with your child, and again, I have a 6-year-old, a 12-year-old, and a 15-year-old. And starting at about age 12, they will actually pull the child away from the parent in the waiting room, and they'll say, I'm going to take the kid into the exam room. I'll come back and get you when we're done. And that, again, I was so grateful for this. It takes the awkwardness, as Amaze says, out of healthcare. You don't have to awkwardly excuse yourself. Your child doesn't have to say to you, well, get out of the room. They don't not share things. I mean, maybe they don't, but it just opens up a lot of doors. So from here, we move into the Amaze video. And this video, I'll play it now. Now I just want to make sure that I'm sharing my sound. So if people have problems hearing, maybe somebody can let me know. But this is the wonderful Amaze video, which really anchors the lesson. And I really feel like videos, if you get the right video, it just ties a whole lesson together and everybody responds well. And again, it helps me not speak as the only adult or authoritative voice in the room. It brings in another perspective. It's a lot easier than getting a guest speaker for every topic. And it really, I think, just rounds out a conversation. So here we go.
Ow! Oh no, a paper cut! Oh, I'm bleeding! Oh, what do I do? Who do I call? Where do I go? Help! Oh, it's not stopping. I'm losing so much blood in here. I don't think I'm gonna make it. Goodbye, my friends.
Sexual health care can include lots of different things, like access to birth control or emergency contraception, STD and HIV testing and treatment, accessing the HPV vaccine, a gynecological exam, or just regular checkups. Depending upon where you live, there may be many places to get sexual health care, or there may be very few. School may be a good starting place. Some schools have a school-based health center and may offer services on site. Another place you might go to is a local hospital, health department, or Planned Parenthood. In some states, minors can get sexual health care without a parent's consent. In others, depending on your age, you may need the consent of your parent to get services. Call to ask about confidentiality if that is important to you. You have the right to ask. Can I get services here without my parent's permission? Will my parent be told about my visit? Will my parent be allowed to see my records? How will you contact me if you need to? Will my parent see the bill if there is one? Sometimes it can feel a little scary, awkward, or embarrassing going to a clinic for the first time. Just take someone you trust along with you for support. Some healthcare centers, like a school-based health center or Planned Parenthood clinic, will be free or low cost. You may also find online tools like apps available to help track a period, help with reminders to take a pill, or find access to sexual health services in your community. And there are also hotlines with toll-free numbers available for specific information, like access to STD and HIV/AIDS testing through the CDC's 24-hour National AIDS Hotline at 1-800-CDC-INFO. Whatever way you choose to access sexual health care, remember, taking care of your sexual health is an important part of taking care of your overall health.
Until next time, don't forget to visit me at amaze.org or go to my YouTube channel to watch more. Bye.
Okay, so I love that video, like so many of the great Amaze videos. And after the video, I'll ask for responses, and then I'll say to the kids, to my class, okay, so what did the video recommend you ask your healthcare provider before you see them? And there's that little bullet point list. So I'm trying to get them to think about the questions that were mentioned. And sometimes they'll get some of them. Sometimes they'll, need a refresher.
Ow!
Sorry, there we go. So I took a screen grab of the video of that image just so we could look through them. So then we talk through the different services and talk about, first of all, how do you make this phone call? Who do you talk to? Is the person on the phone going to actually pick up? Can you do maybe something, they have a texting service? Maybe they have information on their website that will actually help answer some of these questions. A lot of my students don't love making phone calls. They prefer to communicate digitally. So, but we talk through all of these. And the tricky thing is, people here are from around the world, and this is really with an American and New York City lens, but it's going to be different wherever you are. And it's going to be different whichever provider you see. It's so complicated for young people. I'm a grown up and I find this really hard to navigate. And I'm constantly getting surprise bills or seeing a provider who's no longer in my network. And it's a lot for, I think, a lot of us. So then we just kind of go through a few other issues that might come up. So we talk about the issue of confidentiality, and it's different by state. So I can go over what I know about New York, right? But it's good to know what's going on in your location. And we talk also about trickiness with confidentiality, because different providers will interpret different situations differently. So for example, if a young person goes to a provider and says, I'd like birth control, I'm 16, I'm having sex with my boyfriend, he's also 16, and we want to be protected. A provider might decide, well, they might be a mandated reporter in a state where if two kids under the age of consent, and say the age is 18, are sexually active, might feel the need to report that to parents or some other authorities. And that can be an issue that kids should be aware of depending on where they live. And life-threatening and dangerous can be interpreted just differently by different providers. It's also, I think, important for young people to understand that different clinics are going to have to follow different rules. So if a kid goes to a Title 10 clinic, they might be afforded, which get federal funding, they might be afforded confidentiality around certain reproductive and sexual health services that might not apply if they see a private doctor or go to a different clinic. And again, this stuff is incredibly complicated for grown-ups to navigate. But for young people, I think they really at least should have the lay of the land. So just they know, what their rights are and they know where they're going. So I encourage them to always ask if their conversations will be kept private. So at this point in the lesson, either we've had such a robust conversation that our 45-minute class period is over and we are done, and I give them their post-test and some homework, and they are on their way, and we will do a part 2 next time, or we still have time to do this activity, which is a breakout room. And so what I do here is breakout rooms, as all of us on Zoom are familiar with, are when you can put groups of kids or adults or anyone into a separate Zoom window and they can meet in a different group. There's a lot of drawbacks to Zoom. Something I really like actually is the ability to have privacy. So in a breakout room, I will say to students, if there's anybody that you don't want to be in a room with, that you have an experience that this conversation would make uncomfortable, privately direct message me, tell me, I want to be with Ellen. You don't have to tell me why. I will just put you in a different room. It's a lot harder when I'm making groups in person. I'll just go 1, 2, 3, 1, 2, 3. At the beginning of a semester, I will say to kids, listen, if there's anyone you don't want to be in a group with, just let me know. But this I found actually, I hear about it more. And then I realized there's a lot more going on under the surface. It's the same with direct message chatting, where kids can ask private questions or share something that's come up. So there are some benefits to this format. But what we do at this part of the lesson is that I send them to the Guttmacher website, which is a reproductive research institution, and I ask them to look at this chart, scrolling all the way down to the bottom, which just looks at the different laws around the country. And I say, look at New York, that's where you live, right? Look at the legal requirements in New York, who can consent to what, and then compare that to a different state that you don't know a lot about, just to have a sense of the larger landscape. And that also helps us have a conversation about all of these different services and what kids can access confidentially or privately, what they can't, but kind of always coming back to the message that ideally you're going to have a grown-up that you can involve. Somebody you live with, somebody you trust at school. Who's that grown-up? Who's going to be your person? Then we ask, are there any other services that might fall under here. You hear about gender confirmation treatments or intimate partner violence or sexual violence that aren't on here, but could also fall under this umbrella. So that is basically the end of the lesson. This could be a thing that we do in the week, in session 2. Oops. Oh, and then we will have a discussion, right? So we will have a full group discussion, asking what they learned about the barriers, anything that was surprising to them. And then I want them to think about how they could apply things that they've learned to help them overcome the barriers. Could that mean finding the right clinic? Could that mean actually sitting down and having a conversation with a grown-up? Could it mean asking, Aunt Tilly to actually talk to your parents because you're too shy? Could it mean going to the school nurse? What are the barriers you need to overcome? Could it be asking your parents for your health insurance card and saying that you want to go to the doctor by yourself, right? There's lots of different strategies. There are some barriers that are insurmountable, but we want to address the ones where they do have some power and control. And then either we'll do this next thing in class if we are doing a 2-session one, or as homework if we don't. And this is a resource scavenger hunt where they are asked with a partner to go around both our school, not go around, but kind of discover, dig in the archives of our website or walk around to the nurse's office and just find resources at school. So who at school can they go to for help? Okay, the head of their grade in the high school, we have a social worker, we have 2 psychologists, nurses, learning specialists, health teachers. I also ask them to think of a supportive adult of their choice. And if they can't think of one, we try to brainstorm different people. Could it be your track coach or your art teacher or a library assistant? There are people around who maybe aren't on the radar that we want them to know they can connect with. Then we look at some local resources for young people in New York City. And then we look at some national resources too. So this is their homework, to find these various supportive resources. We then post them on our classroom website. And when we come back together, we just kind of highlight a few places in New York that they might want to seek out. So a clinic where they can go if they're over 12, regardless of financial, immigration status, lots of different categories. There's another health clinic uptown in Manhattan where they can look for services. I share information about various local, national hotlines with them. And then we do our post test. So once, either after day 1 or after day 2, they do their post test and ask exactly the same question. But I just thought I would pull some of the comments I got from a few of the post tests out. I think they're interesting in what kids have taken from this lesson. So the first one says, if you can't talk to your parents, you need to have another adult your parents trust to talk to them. Now I know it's a little less confidential than I thought. New York is a great state to live in for access to healthcare. And the last one, I think I'll try to paraphrase it, but I think my awareness of New York City guidelines and rules for healthcare made me more secure and safe. But I think that this student is then saying, looking at other states, they realize that it can be challenging for youth in other states to access healthcare as readily. So that is my lesson. Please, I invite you to stay in touch, reach out any way you might be interested. If you have questions or want to talk sex ed, it's one of my favorite things. And really, thank you so much for being here. So now I am going to turn it over to Caitlin.
Good afternoon, everyone. I'm going to share my screen and audio.
You just put yourself on mute by mistake, though, Caitlin.
That's weird. It won't let me do both. Let me try again. It worked when we practiced it today.
Always, right? Always when we practice, it's flawless.
It keeps putting me to mute. Hold on, let me just try one more thing and we'll see if we can get it to work appropriately. Okay, do you have it now? Okay, and you can hear me, so that's great news. All right, welcome. Thank you so much for being here today. I'm going to be talking about how we can apply the knowledge of STIs and learning about that content to protect our sexual health. Because when we're talking about health education, we know that it is so much more than just understanding knowledge. We really want to help students build the skills so that they can apply the knowledge that we're giving to them. So when I'm using the AMAZE videos, it's always paired up with a skill so that they're getting reinforced the content in a different style. So as Ellen was saying, they're hearing the information from somebody else. In this case, they're able to watch it, see it, view it, hear it, and then reference it back again if they needed to. And then we take that knowledge and we apply it. So the skill that I have paired up with this lesson is being able to effectively communicate an individual's decisions, using refusal skills, and advocating for their own sexual health. So just a brief introduction of who I am. I was the Calvert County Teacher of the Year in 2020. So that was a very exciting, and I actually made it to the finalist round as the Maryland State Teacher of the Year. So for those of you who feel like health education don't matter, we do, we absolutely matter. You have a voice, and just keep advocating and pushing for us and for our content, because I think people are starting finally to listen. I am the Calvert County Wellness Coordinator, so I oversee all of the schools in our county as the wellness coordinator, working directly with them and how we can infuse more wellness opportunities into our school with yoga and mindfulness and health education. I'm also the health and physical education coordinator for K through 12 in our county. And then my final hat is that I'm a health and phys ed teacher, and welcome to my office. I'm in the locker room right now. This was day 2 for us at school. So thank you for being here, especially for those of you who are already in school. I know time is precious, and we just appreciate you coming to the webinar today. On a personal note, I am a mom of 2. I have a 2nd grader and a 3-year-old. So it was very interesting during teaching from home with a husband that is also an educator. I'm a lover of fitness and Peloton. I know that we're groupies, but if you have one, you understand it. I love food movement. I am originally from Buffalo, New York, so I'm a major Bills fan, Bills Mafia. Oh, I see in the chat, yes to Peloton. I'm a lifelong learner, just always looking for ways to reach my students, learning about new things that they're struggling with, dealing with, trying to cope with, and how I can reach them. I am the biggest advocate for health and wellness for specifically youth. And then my social media handle is there, which is at Fit with Fridge. I'm primarily really just on Instagram because one of my boundaries is limiting my social media intake. So you can catch me on Insta. All right, so health education in Maryland, I do teach in a rural county. So even though I'm about 40 minutes outside of DC, we are very different from DC, and we are very rural, lots of farm, lots of agriculture here. But Maryland State really dictates what we do. Our MSDE dictates what our curriculum has to do, and it does include a K through 12 comprehensive sexual health education. In 5th grade is when students get family life, but we are working to move that to 4th grade, and it does happen with the classroom teacher. We use the AMAZE resources at that level, so the teachers have the AMAZE videos and the Advocates for Youth lesson plans to help them. In middle school, in 6th, 7th, and 8th grade, Maryland State requires students to get health, but it's only about a quarter. So even though it looks like it's a lot, it rounds out to be about 20 days per year, which, you know, with all health topics, it's not enough. In high school, they get a half a credit of health. That's all that they have here. So we do our best to give them the content, allow them time to practice their skills so that they can be healthy, productive, successful citizens. So I am at Calvert High School. We have 4 HPE teachers here. 3 of us are all certified in health education. We have our master's in it. And then the other, we just scoop her along with us. She's a phys ed teacher and she does her best. So we teach about 375 students a year as a department. And within that half credit, which is about 18 weeks, we dedicate 4 to 5 weeks to sexual health instruction, just knowing how important it is for our youth to get this information. So to give you an overview of what happens before the lesson and what happens after the lesson, this is the 3rd lesson that we have on STI prevention. The first lesson is the skill we're having students focus on is being able to access information and resources. So students get a graphic organizer. This is where they're introduced to vocabulary. This is where we have them working in partners with small groups, breaking down the information and really doing a gather. After they get the information on their graphic organizer, there's questions that also prompt them to be able to access community resources. So it says, where can you get free STI testing in Calvert County? What are the hours? What's the phone number? What is the website? So that students can access. They're proving to us that they can use their phones, digital devices, computers to be able to access that resource that's right here in their backyards, and helping them understand that it is free, it is confidential, and just being able to give them that information so that if or when they're ready for it, they know how to access. Lesson 2, we put them through case studies where they get different scenarios. So we have students work in small groups and they each get different scenarios that are around STIs and how to prevent STIs, and they have to problem solve and go through the decision-making steps for the scenario that's presented to them, and then the students share out each of their case studies. The 3rd lesson is what I'm going to review today with you is protecting sexual health from disease. So now we have the information, we understand why it's important, so how can we take this information that we know and apply it? Which means, how can I communicate my choices, my decisions, my boundaries? Once we go through that section, then we hit the final piece, which is advocacy, and we use Canva, and the students create STI awareness posters that we can share on social media feeds, that if we have really outstanding ones, we will blow up and create as posters to have student work up around our classroom and through our teaching space. And the advocacy project is really awesome because we allow them to choose what they want to advocate on, what piece of all of the lessons that we've gone through in this section. So there's a lot of student choice and voice there. So the lesson information specific, we work off of lesson essential questions here in Calvert County, and it's a broad definition of what you're going to be covering in about a 4 to 5 period time frame. So it's what you want your students to be able to do as a result of the lessons you're teaching. So we've decided that in this section, we want students to be able to effectively communicate their decisions and personal boundaries around STIs, potential contraceptive use to protect their sexual health. So the learning objectives you see here are actually our Maryland State Healthy Behavior Outcomes. That's where these were pulled from. So you see the skills of communicating effectively, being able to demonstrate refusal, negotiation, working together with collaboration, applying a thoughtful decision-making process, being able to predict short and long-term outcomes, and then defending a healthy choice when making a decision. This is how we create our assessments or our assignments for our students. This is what drives how we assess our students when we're lesson planning. So hopefully the volume works, because I had to do it a little bit differently than we did when we practiced. So Nora, I can see you. Can you hear it?
Oh, don't worry. You can't get infected.
I think you just went on mute by mistake, Caitlin.
The whole screen is frozen, so I actually thought I 100% lost you. So I was very happy to hear your voice. Everyone's frozen.
Oh no.
That's okay, as long as you guys can still hear. So I'm gonna play the video now.
Yep, perfect.
Oh, don't worry. You can't get infected. It's only... my allergies.
Sexually transmitted diseases, or STDs, are diseases, infections, or illnesses that can be spread from a person with an STD to another through sexual contact. That includes genital-to-genital contact, which is contact with penises, scrotums, vulvas, or vaginas, to any kind of sex, oral, anal, or vaginal sex. Some STDs are fairly common, so there's nothing to be embarrassed about if you ever get one. Some STDs do not cause any symptoms, so many people who have an STD do not know it and might spread it. For those who do have symptoms, they may experience soreness or swelling around the genitals, bumps, sores, or rashes on the genitals, itching, burning, or pain while urinating, and girls may get a vaginal discharge that is different from normal. If you have any of these symptoms, or if you've had unprotected sex, it's important to get tested for STDs. STD tests differ. Some are blood tests, some test urine, and still others use a swab of saliva or a discharge. Even if you use protection, it's a good idea to get tested for STDs at least once a year. You can get an STD test from your healthcare provider or at a family planning or STD clinic. Some STDs can be cured while others cannot, but their symptoms can be managed with medication. Some STDs, if left untreated, can cause serious health problems later in life. So remember, once a person becomes sexually active, it is important to use condoms and other latex barriers and to get tested for STDs regularly.
Tissue for your allergies? So, till next time, don't forget to visit me at amaze.org or go to my YouTube channel to watch more. Bye!
So when we present this lesson to students, remember students have background knowledge. And so we use this video here as a way to just bring back that knowledge from the last 2 days of learning. So we review the video, and if you used Nearpod or Pear Deck while you were virtually teaching last year, we were able to embed the video into Nearpod. And so as the students were going, as we were going through the video as a group, it asked the students, it paused throughout the video and asked them specific questions that we really wanted to reinforce that the video was sharing with students. So if you've ever used Nearpod or Pear Deck, it's a great resource to have student voice to make sure that everyone is engaged and that they remain engaged. So you can see this was the actual full lesson that we had for our students. And we had the 2 videos because we were reviewing, and then we worked in the open-ended questions. So I'm going to share a couple of the open-ended questions that we did. But if you're not familiar with Nearpod or Pear Deck, it is a fantastic resource to allow every student to have a voice without them being embarrassed with sharing out loud. So when students go in and they log into your Pear Deck or Nearpod, which can be done on a computer or an iPad or a phone, the question will pop up and the presenter or the teacher can have that information posted, but every student can respond, and they can respond without their name showing up. When you run the report at the end, you can see all of the students' responses, which is fantastic because you can make sure that every student understood the material, they were engaged in the lesson. So this would be a student preview on their phone, device, or computer. The prompt is you and your partner are talking about sexual boundaries. You have decided to delay intercourse because you aren't ready to engage in sexual activity. How do you share this belief with your partner? So then the students write in their response how they would share with their partner that they're not ready to engage. So when you look at each of the open-ended questions, that's what it's doing. It's prompting the students to advocate, to use refusal skills. We also used collaborative boards so that students could pop up their responses if they were struggling to find different ways. So for this question, it asked ways for students to be intimate that are not sexually active, helping them to understand consequences of their actions and behaviors. And then we had a time to climb at the end to review the material, which is like a Kahoot. So the questions pop up and the students can respond. It's a little competition. It's very friendly. They all have fun, and it's a great way to reinforce the material, the content. So just to briefly go over the two scenarios that you would have seen in the discussion prompts for students. The three questions that would have followed for that were, how can having a conversation about STI testing how can you have a conversation without offending your partner? What types of emotions do you think you will feel before, during, and after? And this is really important to help students understand that, you know what, I'm probably going to feel very uncomfortable starting this conversation, but afterwards I'll feel relieved because I stood by my own values and beliefs. And then helping them see the value in effectively communicating about their sexual health. The second scenario I want to go over is, you and your partner have engaged in sexual intercourse with protection in the past. Your partner is pressuring you to have sex without a condom because they claim it feels better without. So then we have students go through these prompts. How can you communicate with your partner to resist peer pressure and protect your sexual health? Why is it important to advocate for yourself and refuse pressure to participate in risky behavior? And then predict some potential outcomes of this conversation and health consequences. So now students are responding directly in this, and you, as the teacher, as students are responding, you can call out their answers and say them out loud without the student feeling embarrassed by or shamed or just scared, because we know this is a hard topic specifically for our 9th and 10th graders to talk openly about, but it gives all students voice. So we have some time for question and answers.
Great. I think, Caitlin, if you can just stop sharing your screen and then we'll flip it over to Dan. Perfect.
All right. First, I just want to thank Ellen and Caitlin for two really amazing presentations today. Thank you so much for sharing your time, your expertise, and your really brilliant lesson plans with all of us. We'd love to hear any questions folks have. If you want to go ahead and submit questions for Ellen or Caitlin into the chat, now's the time. We're getting some great comments here that the scenarios were super helpful. Excellent. Glad to hear that. Any questions that folks might have?
Looks like we had Jean raise their hand.
Jean, yes, Jean. I had chatted Jean. Jean, did you have a question? Oh, it looks like Jean doesn't have a question. She didn't know she raised her hand. Okay, no problem. Just want to make sure we didn't miss you. Hi, Debbie. Debbie says, great presentations. Agreed. So we have a question here from Kelly. How do you handle guardians who may not agree with comprehensive sex education? Great question. I'm going to throw that one to, we'll start off with Caitlin, and then I'll throw it to Ellen as well and hear from each of you.
This is a fantastic question, because I do teach and live in a county that is very resistant to comprehensive sex education. So we get resistance often, but a lot of times it comes from a place of fear. And so right from the beginning of the health course, I send out a parent letter that just outlines all of the topics we're going to discuss, and I actually put the healthy behavior outcomes from MSDE linked in an Excel doc chart so that they can see exactly what we're going to be talking about. And I feel instantly it relieves some anxiety because they are seeing an outline of what specifically will be talked about. It also gives parents the opportunity then to ask me specific questions about topics, which is good because I think they see the outline and understand that a lot of the stuff we talk about, consent, what does it mean to be in healthy relationships? How do we take care of our bodies? How do we determine our values and beliefs? They're like, oh, wait, I want my kid to do all of these things. This is really good. But I might have some questions here. And that's when I pick up the phone and we have a conversation. And I've been teaching for 14 years, like I said, in a conservative county, and I've actually never had a student completely opt out. So the communication is really big in releasing parent fear.
So I don't have too much to add. I'm in a pretty different environment, and I do feel a lot of parental support from most parents. But I think just to echo what Caitlin is saying is that transparency has been the most important way to help parents not feel scared of what you are teaching. If you share your materials, if you talk to parents, give presentations, and just like you're saying, take some of the fear out, but also hear their concerns, I think that is absolutely the most effective strategy. What's interesting for me is when I want to have students opt out because they feel triggered by a topic or because it's just too difficult for them. Sexual violence, eating disorders are common ones where a student themselves will feel like this is not a safe place for me to be. And that is actually something that I've dealt with a lot more. And of course, I never want a student to have to sit in a class, which is triggering or traumatizing. So that's where I put more of my energy kind of navigating those situations rather than parents.
Great. Thank you both. Ellen, while I still have you, we have another question that came in for 10th grade in our district. They're getting sex ed for the first time since middle school and possibly nothing in middle school. They have 5 90-minute blocks to complete the topic. Where do you feel is the best starting point for sexual health? What's a good?
Yeah, I mean, in 10th grade, in 5 sessions, I would probably save this as a kind of adjacent topic because I think that the students probably, so for us, this lesson would come after they'd had a semester of 9th grade. So like Caitlin was saying, you know, this is her STI lesson is kind of the 3rd. And for me, this would come after really a whole unit in 9th grade on sexual health. So we talk about a lot of different physical conditions and sexually transmitted infections. We also talk about sexual pleasure. We talk about a whole range of different expressions of sexuality before we talk about actually going to a healthcare provider. I think, as I keep on saying, it's a crucial topic, but I have the luxury to not be limited to 5 sessions. So I think that, you know, for me, the topics that are really absolutely crucial are safer sex, consent, identity, healthy relationships. Those ones are where I would focus if I really just had to, and bodies, you know, pick 5.
Great, thanks. Caitlin, anything that you would add?
It's so funny because as she was listing it, I was echoing in my own brain. And we have very limited time in our 8th grade, in our 7th and 8th grade. So that is how we have our 8th grade broken down, is just understanding personal boundaries, values, and beliefs around the topic, healthy relationships, consent, talking about abuse, and then we do like a quick disease prevention, pregnancy prevention as the 5th lesson.
Great. Seeing some consensus in the chat as well. Awesome. Next question was, at what is the age range to start sex ed? And I saw a follow-up question in here that was, are we talking about school-based sex education? Are we talking about sex education with parents?
I mean, I will say with parents from birth, I mean, that is, you know, from infancy at home, get your, you know, amazing roster of books. We have so many amazing resources right now. My little one, Dr. Lex, has a book, you know, This Is My Nose, These Are My Toes, This Is My Vulva. And when my child was 3, I got her that book. We have, you know, a whole range of Roby Harris and the Corey Silverberg books, and Deb's books. So we have just a lot of resources that we pull from, also from my home country. I'm a fan of my Meg Hickling, who is a Canadian educator who I got sex ed from a kid and got the National Order of Canada medal. So I think that there's a million wonderful resources out there to start at home. In school, I think in a lot of ways, and we don't do this, it should start in kindergarten, preschool, right? With consent education. We're not talking about how do grown-ups have sex, but we're talking about body safety. We're talking about boundaries. We're talking about relationships. We're talking about how we take care of and treat our bodies. And then we progress into different kinds of expressions.
Great. I think we have time for one last question. The question that came in what ways do you address stigma around STIs so students understand how common they are for so many people? Also, do you explore with students the reasons why it can feel so shaming or embarrassing to have an STI?
We do discuss. I actually have an article that I share with students, and it's written by, it's like a blog post written by like a 20-year-old woman, and she discusses her life with genital herpes, and it puts into perspective that she shares her story, that she always was safe. She limited her sexual partners. She used condoms. So I share the article not for fear mongering, but more to say that this is more common than people claim. And it doesn't mean that you're dirty. It doesn't mean that you're careless. So we really start to break down that stigma. And then we ask students to share why they feel it's so shaming or embarrassing, why they're likely to send somebody a picture of themselves, but they won't talk to a doctor about their sexual health. Like having them think about that for a second. Like, why would I anonymously send a photo of my private parts, but I won't do that? I won't have a conversation about my sexual health with a professional. So it's kind of just getting them to think about that, and how our culture and our norms have shifted us into thinking a certain kind of way.
Great. Thank you both so much for your expertise, for your time. Nora, if you could advance us to the next slide, just a couple quick things. We are going to be sending out a link to an evaluation. We would love to hear from everyone. This is how we keep our webinars going and keep these great topics coming to you. We have great teachers, and we'd love to hear your feedback. We'll send the link in the recording and resources by email by the end of the week. And those of you who respond to the evaluation will be entered into a raffle. So definitely take some time to fill that out. Also want to shout out to our Amaze Sex Ed Con. Our conference is coming up October 26th through 28th. This will be our second annual Amaze Sex Ed Con. So we hope that you will make some plans to join us there from 3 to 5 p.m. Eastern on the 26th, 27th, and 28th. And finally, if you're looking for Amaze on our social handles on YouTube, Facebook, or Twitter, you can find us at amaze.org, and Facebook is amaze.org/parents, and info@amaze.org if you have any questions for us. Thank you again to Ellen and Caitlin for their amazing presentations. Thank you to all of you for joining us on a Wednesday afternoon. It was a pleasure. We hope everybody has a safe and wonderful afternoon and rest of the week. Thanks so much.